Dr. Matt Halpert, welcome to the 𝙆𝙍𝙬 podcast, my friend.
Oh, yes, thank you. Thank you for having me.
So we connected in Utah, Dr. Pompa's event. We shared the stage together. You were on right after me, and I got to see you speak. Dr. 𝙆𝙊𝙍𝙍𝙏 connected us, and he's been on the podcast before. Actually, we recorded it right here at my 𝙆𝙬𝙬 HQ. So you're working with him.
Okay.
And I was blown away by your presentation, and I just love your passion and desire for helping people overcome what many people think is a life or a death sentence, I should say, being diagnosed with cancer, or what can we do to be proactive? We'll talk about all that, but I was just blown away by your work, and we connected, and now we're doing a podcast. So thank you for being here. And I would love to start with, the backstory. What were the moving pieces that got you towards studying cancer, studying the immune system, and doing the work that you're doing today, Doc?
Yeah, absolutely. Thank you for that. And yeah, thank you. In Utah, when you presented before me, you didn't know this, but you had set me up perfectly for my talk. So
yeah,
appreciate that. So yeah, it's awesome to be on this podcast with you and get a chance to share more of this story with you. My background is I have a doctorate in immunology with a specific focus on inflammation and microbiology and the way the immune system operates and should operate. I then spent about 10 years in the Texas Medical Center, predominantly at Baylor College of Medicine, as an academic researcher, focused on cancer and cancer immunotherapy. More specifically, the research group I was with had made what we now know is an extremely important discovery regarding how the immune system works, the physiology of it, how from the top to the bottom, how it goes about identifying a threat, whether that threat is a virus or, in the case of what we'll talk about today, cancer, and then how that immune system can essentially be reprogrammed or correctly skewed towards fighting that threat. So after years of doing that research with my own hands and in collaboration with my team and other labs around the country, we were doing all the normal science things, publishing papers, getting grants, moving things down the track. And we did reach a point, and we're in a point where we have multiple FDA-approved clinical trials right now that we've managed to push this science into to treat very difficult cancers, including GBM, which is a very aggressive and lethal form of brain cancer, a very aggressive form of pancreatic cancer. FDA just approved another trial for 𝙎𝙬𝙎𝘼𝙎𝘀, which will be hosted at MD Anderson. Triple negative breast cancers on tap. And because, so we're going for all these cancers, we're going down the regulatory pathways. We do want this to be widely available in the United States and reimbursable by insurance and things like that. But after years of kind of being involved with the research and seeing the regulatory hurdles and recognizing the time this would take to actually reach the clinic where it would help people, I decided to try and, within legal parameters, set up a almost compassionate use opportunity where cancer patients who could benefit from this treatment today have a way to get this today, rather than having to try and wait 10 years or whatever it'll take for the FDA to approve it. So that kind of brings us to the formation of Immunocine, which I know we'll talk about, and the opportunity for patients to essentially again, I like to use the word physiological, but you can use biologically natural or even holistic, in a way to get your immune system properly reprogrammed to identify and fight the cancer. We have a way to offer that today. And so that's sort of the background of what brought me to, as you mentioned, that conference in Utah, where we're trying to spread the word and get the word out to doctors and various unmet populations that could benefit from this.
And it's a game changer, Matt. I mean, because if we look at the traditional way to treat cancer, is just not working. They declared war against cancer, and that war is being lost every single year. And we think about, chemotherapy and some of the survival rates for that, and
Right.
just traditional treatment. So what you're doing is groundbreaking. And you said the immune system several times, because you've mentioned before that the immune system is king here. So what is it with Immunocine in what you're doing that helps to optimize the immune system so it could clear a cancer more effectively? What's going on there? How are you doing that?
Right. Obviously, a great question. And so, we mentioned the war on cancer and the various treatments, and we can talk obviously a little bit about a lot of current standard of cares like, chemotherapy and radiation obviously are well known, well documented. Everyone has heard of them. I feel like it's not a huge secret that though they do work sometimes, they possess the ability for a lot of collateral damage. They don't always work, often leads to relapse. And I like to use the analogy there that if cancer is like knowing that there are bad guys in a building, chemotherapy would be like dropping a bomb on the building and hoping to get all of the bad guys. Mm-hmm. Now you might, but you will have collateral damage. And if you do not get every bad guy, it's, whether you can see it on a scan yet or not, it's not gone. And relapse is definitely potentially in the future. Using the immune system and immunotherapy is a little more like using the Navy SEALs to go into the building and very specifically identify and eliminate those threats rather than just this kind of widespread destruction.
That sounds a lot better than me. I love the second option much better.
Oh, and not to belabor the point, but this is where we are heading. And I mean, nothing in science or medicine moves fast, but from the first successful completion of the immunotherapy trials in 2011 and the approval of some of those drugs in the space of immunotherapy, within 10 years, immunotherapy has done in several cancers what chemotherapy has been unable to do in over 100 years. And
wow.
And I'm always happy to talk more about that, but it is very evident, I think, to most doctors and scientists in the space that the actual, if we're going to get to cures, it's going to be in the space of immunotherapy and rearming the immune system. That's where this is going to go. So where does Immunocine fit in, and what is it that we are doing, and how is it unique? And I mean, these are kind of obvious questions, but so whether we want to hear this or not, Ben, you and I, as healthy as we are, and I think we're both pretty healthy, are kind of continually developing our own cancers. Cancer is really, it's one cell becomes two becomes four becomes eight, it keeps going, and eventually this mass of cells is what we call a tumor. Now, the underlying mutation, the underlying reason for that, and why that was not fixed, that's a whole nother podcast, right? Yeah. Like, there's a lot of reasons for that.
It's never one thing. It's a multitude of things.
It's a multi-hit, right? And as we get older, more mistakes happen, and this just occurs more. The thing is, we have mechanisms in place to protect us. Our immune system, our defense system, protects us from viruses, bacteria, germs, all the time, including cancers. We have cells and abilities that actually can identify cancer cells and eliminate them. So one cell becomes two becomes four becomes eight, and so on, and the immune system wises up to that, goes over to those cells and says, hey, you don't belong here, go away, and the threat is eliminated. And we don't even know it. It's just, okay. In the case of, cancer, that is now being viewed on, a PET screen or something else, cancer markers are elevated. For some reason, reasons we do not entirely understand, the immune system has just completely missed it. It is oblivious. It does not see this as a threat. And this is termed immune ignorance. You already have a defense system within you that is capable of overcoming this issue. But it's sitting on the sidelines twiddling its thumbs. It just doesn't know. And a lot of immunotherapy approaches today, given that in some sense we're still in the infancy of immunotherapy, and I say that with the view of centuries, sort of thing. Some people are coming up with some interesting ways to hijack the immune system. So you've got this immune system from start to finish, and obviously it'd be ideal to start at the start where the immune system is normally beginning and then get here. But since not everyone can figure that out, people have found ways to kind of interject, and maybe we can boost this or do this or do this. And sometimes that actually works. I mentioned before the FDA, the approved immunotherapy product after the trial finished in 2011. That was a checkpoint inhibitor drug, which is the first drug. It was essentially, discovered the whole process by Dr. Jim Allison, who's now the director at MD Anderson. He recently won a Nobel Prize for this work and is in some ways considered let's call it a father of immunotherapy. And what he was able to demonstrate is that simply by removing or blocking one breakpoint on the immune system, just one, instead of 100% of those cancer patients in that trial dying, only 95% died. And you might say, so 5%, big deal. Like, that's not very awesome. But the other way to look at that, of course, is, well, wait a second. What happened with this 5% of people that are now completely cured?
That's
because
5 lives.
all it did.
That's like 5 lives out of 100 lives, right? So that's 5 lives.
It's not insignificant, and it tells us right then and there, the immune system can do it. I mean, in this small population of people, what was different? And why did they respond so much better? And how can we use that? And more study tells us very obviously, I think, what was different about those 5 lives out of 100. And that is that they actually already had an immune response trying to fight the cancer. It just wasn't strong enough. And in that case, if you boost it, yeah, that might be all you need for your immune system to get the upper edge, and just take it out. So the issue, of course, is for those other 95%. All right, we got to get your immune system off the sideline. It needs to overcome that ignorance. It needs to start fighting. We can worry about boosting it later. Let's get it started. And that is exactly what Immunocine is doing. That is the exact discovery we made. And so I get very wordy about this because I'm a scientist and I just kind of can ramble about science. But from being discovered in the 1970s, we know for a fact that dendritic cells are a type of immune cell that run the whole system. They are the generals of the immune system army. You can Google that. It's not hard. In any immune hierarchy or pyramid image, they're at the top. Honestly, their job was to identify this threat and then orchestrate the response. I mean, they're honestly the ones that fell asleep at the wheel. And so knowing that, you fast forward to the 1990s and there's just a ton of interest in, okay, if we can figure out how to re-educate or rearm the dendritic cells, we might be able to get people's immune responses to overcome the cancer. A lot of money went into it, and no one could get the dendritic cells to go. There still were missing pieces. We didn't fully understand the science. And so eventually, after many failures, that's where everyone had to move on and find other ways to try and hijack the immune system. The discovery we made was specific to dendritic cells, how dendritic cells function, what those missing pieces were. And when we identified that, it became very, very obvious how we could then use dendritic cells to reprogram a person's immune response to target cancer. And so that's what all our publications are on how we have identified that mechanism within dendritic cells and how we are using it. That is what our FDA clinical trials are on. That is what all of our patents are around. And that is what we are doing in Cancun, Mexico with our compassionate use team with Immunocine Immunotherapy. It is reprogramming, that is from the top down, reprogramming patients' immune responses, immune systems from the dendritic cells all the way down through the killer cells to wake up and go actually fight the cancer, actually do their job. And so that's what we're trying to offer to people who want to add that tool in their tool belt or that weapon to their fight against cancer.
Hey, I want to take a minute to share something with you as we take a break from the video you're watching. One of the most common things I see to why people don't have enough energy levels, they have trouble building lean muscle mass, they have brain fog, fatigue, and they don't feel good is because of a deficiency in a hormone called testosterone. Now, testosterone is a very important hormone to have in a healthy amount for both men and for women. So, how do you reclaim your vitality? How do you reclaim this very important fat burning and muscle building hormone? Well, you can do it with a powerful supplement called Upgraded T. It has been my go to for naturally elevating testosterone levels. Upgraded T is from Upgraded Formulas, and it contains the highest quality of ingredients that have been proven scientifically to increase testosterone production. Now, as I mentioned, if you're a woman watching this is very important for you just as a man watching this right now. Upgraded T is a natural and safe way to boost testosterone levels. When you boost testosterone levels, it's going to increase your sex drive, vitality. It could help replace fatigue with all-day energy. It'll help you lose that stubborn belly fat. Testosterone is required for fat burning, so it'll help you with the last 5 to 10 pounds that you're looking to lose. It helps you be in a better mood, helps with your memory and focus. So here's the 3-step approach. Step 1, take 2 capsules of Upgraded T with water every morning. It does not break your fast. You can have it with food or without food. Step number 2, notice your energy levels and dominate your day with more confidence and more vitality. Step number 3, wake up the next day having better sleep and just keep doing what you're doing. As simple as that. So if you want to get your hands on Upgraded Formulas, Upgraded T, and any of their awesome products like their Upgraded Magnesium and their hair mineral analysis testing kit, head over to upgradedformulas.com. And if you use the coupon code ketosis at checkout, they're going to give you 15% off your entire order. That is upgradedformulas.com. Ketosis at checkout. We're going to drop that link down below. And let's get back to today's video. That's so fascinating. I want to unpack a little bit about what you just shared and then talk about specifically how the treatment works. Let's say somebody listening or watching wants to get the treatment. I would love for you to explain how it works. But let me just recap what you said in case this got lost in the conversation. We all have cancer cells, but our immune system, specifically the dendritic cells, which you call the general, will identify those threats. So if one cell turns into 2 to 4 to 8, like you said, boom, it's identified as a threat that it's growing, and then it takes care of it. But what has been happening is the immune system is now developing ignorance, and it's getting lazy for whatever reason. You said you're not sure what the reason why. It's hard to identify why it's gotten lazy, but now cancer starts to get out of control, and they, for many, many years, wanted to determine what can we do to activate the dendritic cells, and there was a complete failure. But with your breakthrough research, you've actually found the way, which is super powerful. I want to talk a little bit about that, but you said you're not sure why the immune system becomes ignorant. Do you have a guess? Is there like something you're leaning towards? Like what are the top why it's become ignorant?
Well, it is true that so you're okay. So sure, I can give a couple of hypotheses or theories.
Yeah.
But and of course, dendritic cells do, of course, run the immune system. I don't want to discount, of course, other immune cells for anyone watching who might ask, what about natural killer cells or killer T cells? They all, of course, become involved. It becomes a global process. But so look, here's an example. I mean, obviously, as we age, we just tend to break down more. We tend to be not as healthy. We don't recover as quickly as when we were, teenagers. And while that is an obvious outward reality, it is also an inward reality. Mutations are not repaired as quickly. And of course, the secret to aging and overcoming aging is a very hot area. I don't know if you've had any guess on that, but that's a really interesting area to us as well. But for example, the immune system does not have a pump. If you lay in bed, your immune system actually becomes very stagnant. It does not move. For your immune system to circulate and survey your body successfully and fully, you need to move. You need to have adequate movement each day. You need to exercise. When we are kids, when we are younger, we are almost constantly running around. It is hard to sit still. As we get older, we do a lot more sitting. We get lazier. We do not make that effort sometimes to exercise every day. And so as strong as the immune system may be, it is now not surveying your body as swiftly as it should be. And this is, in a sense, this is something we could easily overcome by adding more movement to our day. Additionally, we are chronically inflamed. Another kind of hot topic, right? I mean, our Western diet has been well documented. I could go into studies where it has been very well shown that causes just a continual state of inflammation. But you know what? Sitting at a desk causes inflammation. We are dealing with a lot of inflammation, and basically in that sense, in the sense of a targeted immune response against a bacteria or a cancer, you want inflammation. That's an immune response. That's good. In the sense of just ongoing, non-specific inflammation, your immune system is literally wasting its resources erroneously. So instead of conserving all of that power to find actual threats, your back is inflamed and is painful because, you ate 5 burgers for lunch and you sat, watching Netflix for 6 hours, and, that can be fun for a day. But if you do that repeatedly, well, now you're all this inflammation in your back. That is evidence. If there's not an actual physical reason for that, it is kind of evidence of we're driving our immune system to be dysregulated, not conserving its energy or its resources, and sure, that is going to weaken it. I'll give maybe a couple more reasons, because now that you got me started on it, but I did kind of almost seemingly a silly one, but sunlight. I mean, our bodies, it's again not really a secret if you dive into the scientific publication. We do need sunlight. Our bodies do, we don't need 8 hours of sunlight a day, but we do need sunlight, and we don't all work on farms anymore. And so we work in offices, we're sitting, we're eating fast food. I mean, I just named 3 things that will cause all kinds of problems. And yeah, I know that you're obviously pretty big into the diet, and that's obviously a major one too. How are we fueling our bodies? Again, when you're young and you're moving around, your metabolism is high. Your body can really process a lot of junk, and it won't just rest and sit in your body and cause problems. It doesn't mean you should eat junk, but it's just your body's more able to handle it. And again, as we get older and things just start working a little slower, you do have to be careful what you are eating and how you are fueling. Your body will use the path of least resistance in terms of energy consumption and how it operates. And in some cases, if you're running a race against 10 other people, you want to follow the path of least resistance. You're trying to win a race. But most of the time, if you're trying to get stronger, in the gym, path of least resistance is not your friend. Add more weight. And in a sense, it's sort of the same here. You eat simple carbs and sugars and things that your body can very easily break down and use. It will, but that is not necessarily the best stuff to empower your underlying functions, your immune response, and things like that. And so I do feel that people do not watch their diets anywhere near as close enough as they should. And so those are just a few. Again, maybe nothing earth-shattering there. Exercise, get some sunlight, eat right, get some sleep, try to reduce get some good sleep, reduce the chronic inflammation. And I don't know if people hear that and say, yeah. Well, it matters. I mean, it really just does. It's simple in a sense, but it matters. And we don't take it seriously enough. And I think we set ourselves up where you start reaching middle age, especially in later age, where cancer shows up more. And I don't know. I mean, if you've been chronically inflamed for years, you don't exercise, you don't eat right, is it necessarily a surprise that your immune system got lazy and missed these over-replicating cells over here in the corner? Maybe not.
For sure. Yeah. So that was a very important breakdown. So I hope y'all listening and watching take notes, right? When we talk about the importance of the immune system to prevent cancer, to reverse cancer in some cases, what can we do to support it? And Matt just explained how you do it. Move your body. I mean, we always talk about the benefits of movement, getting 10,000 steps a day, and there's a lot of benefits to it. But in regards to the immune system, if you move your body, you're going to move the immune system. It's going to work better. So find a way to keep moving, walk after meals, stand-up desk. Like I'm sitting now, but this is a stand-up desk that I alternate up and down, up and down. But I'm tracking my steps and I'm getting about 10K a day. And then, of course, chronic inflammation. You talked about acute inflammation being very important, but that chronic low-grade inflammation, putting that immune system to sleep, not good. And there's a lot of things that could contribute to that: processed food, junk food, artificial light. I love that you talked about sun. When you first said the sun, I'm like, okay, I'm not sure where Matt's going with this, because a lot of cancer people say to avoid the sun. And I'm glad you said to get some sun, not get burned, but get the sun, because I agree that's very, very important. And then I would add one more thing to the list there in terms of what I believe wrecks the immune system. And I would say living in a fearful, mentally stressful state will lower your system. Would you agree to that, Matt?
Oh, absolutely. We recently had a patient who was asking, those cortisol levels, when you're in a constant state of anxiety and stress, again, this is not my opinion. This has been documented in strong papers. Your immune system is definitively weakened. So that's actually a good one. I sometimes we have to help patients. I mean, I know it's not easy, but you do have to try and find a way to calm down, because that constant state of stress, anxiety, being fearful, being on edge, your body has to deal with that. I mean, you might not think about it that way. You might think, oh, it's just in my brain, just in my head, and it's just emotional. It's actually not. I mean, your body is secreting certain neurotransmitters and hormones, and it actually has to deal with that. And yeah, the immune system absolutely gets wrapped up in that. It gets weakened. It doesn't have the resources it needs. Believe me, I'm not one to talk. I know it's easier said than done, but it is that I'm glad you brought that up, because it does belong on the list, just equivalent to all the other things.
Yeah, the best thing to do if you feel like you're chronically stressed, at least mentally, emotionally, is get your vitamin G, right? Gratitude, like practice gratitude. It's almost impossible to feel pissed off and angry and in a fearful state and be grateful. It's like they're completely opposite. But like Matt said, it's easier said than done. You need to be intentional and consistent with it. But the reason I brought up the stress part and the immune system is because I remember when I interviewed Dr. Bruce Lipton on my show a couple years ago, he gave the perfect analogy of what mental stress does. Cortisol, you mentioned cortisol, what cortisol does to weaken the immune system. He gave the example of a patient who is about to get a kidney transplant, right? This patient needs a new kidney. So this patient is in the operating room, and the surgeon that's about to perform that surgery will inject the patient with stress hormones, including cortisol. Why? Because it completely distracts the immune system, wipes it out, so then it could accept that foreign object, which is the new kidney. And that's the example that he gave, what stress is doing to our immune system. It's completely distracting it. Would you agree that's exactly what's happening?
Mm-hmm.
Yeah.
No, absolutely. It's a little bit like the inflammation. You've got non-specific activity going on now. I mean, there's been a rise in cancer. There's also kind of been a rise in stress. I mean, maybe that's even closer, more linked than we might give credit to. I mean,
it's a very important piece. So I'm glad
everyone needs to calm down, go for a walk outside, and
turn off the news. Don't watch.
Turn off the news. Eat your fruits and vegetables. Get a good night's sleep, and you'll be fine.
So let's talk about Immunocine, right? Let's say somebody listening, they want to learn more. Potentially, they might know somebody with cancer, or maybe they have cancer. Like, what is the process? How long typically does it take, and how does it work?
Right, absolutely. So as I mentioned, Immunocine was so there are cancer treatment centers and other things you can find on the internet. And I would, I'm not going to sit here on this or any podcast and call anyone out. I would caution any of your viewers to just make sure they do their due diligence, do their
What should they look out
research.
for? What are some red flags?
Well, I did write a blog about this, and so I could maybe share that with you after. But a few red flags are if a group trying to recruit a patient will not be very forthcoming about what their science is, if they have no evidence of attempted or clinical trials at all, do they have any legit scientific publications? I mean, these are not necessarily high bars for actual scientific endeavors, but some of these groups out there, they're kind of squirrely. Some of these are extremely misleading. They will. I saw one that wrote a whole blog on some long lost cure for cancer, and they had 42 references at the end, and it made it look like it was well referenced. If you look at those references, not a single one of them had to do with what they were talking about.
Oh, wow.
Which is just a very misleading way to make it look one way, but actually not be that. Compare that to Immunocine. When we send people a dozen or 24 publications, I'm personally an author on over half of them. My colleagues are authors on the rest of them. I mean, I could grab thousands of publications about dendritic cells and their role in cancer. This is our own science. We have our own publications in very good journals, Science Translational Medicine, Blood, FASEB, from 2006 till current. We have our own clinical trials. We're not hiding. We're not hiding from mainstream medicine. It just takes time. You've got some other groups that have been around for decades and they still haven't run a single trial. And a lot of the excuses they give are, people might accept them at face value and they shouldn't. There's no excuse. It's the FDA there are over 3,000 trials right now for diet and cancer. I mean, if you have a magical diet, it's not impossible to run a clinical trial and demonstrate, publishable success. So, those are issues. Again, not the reason I'm on this podcast, but in talking to patients, they don't often know. You bring up a good point. What should due diligence look like? And so I'd almost want to refer them to a blog I wrote in which I do outline a few key things. Yeah, we might add that because we were getting that question a lot. Like, what do I look for? And so I say all that to say Immunocine was actually not started as a cancer clinic where we are now grabbing different treatments. That is not why we formed Immunocine. We had the science and we had to figure out a proper, high integrity, ethical way to offer this to people. And so we created Immunocine on the back of the science. And so we found the right, team of doctors, which includes specialists like oncologists, radiologists, hematologists, like that. We have the right scientists. We have what would be considered an FDA compliant clean room lab, where everyone's personalized immunotherapy is made. And that's all in Cancun. Everything happens in Cancun. We do have approved protocols, all our certifications and things like that. So Immunocine starts. You asked a little bit about, I think, kind of the logistics of what might a person...
Yeah.
Okay, I want to go to Immunocine. And so I have to start off by saying Immunocine is not a walk-in clinic. That is another red flag, FYI. I personally do not understand how some of these other centers simply say, come on down and we'll treat you, without knowing anything about the patient, their cancer, what have they tried. How do they know they're going to be able to offer something safe and effective without these details? So we do a full medical review on all patients, and this includes recent oncological summaries, recent scans, recent blood work. We will happily talk to their doctors if their doctors are open to speaking with us. So we go through all that. It is complimentary. We do not charge the patient anything for this, but we want to offer this to patients that we think will be safe and we think in good faith will be effective. We're not here just to take people that shouldn't do this, either because they don't have the time or they don't have the right set of circumstances.
And you could do all this before they make the trip to Cancun?
Correct.
Yeah.
Correct.
Okay.
This is all, our patient coordinators will reach out to the patient who's expressed interest. We will get a medical questionnaire filled out. We'll get a little information. We'll move to a HIPAA compliant online portal where the patient will upload or send to us their records. Again, we can assist and help get those records if the patient, is unable. And then our doctors will look through everything. This will take a week and a half for everyone to sign off and make sure, yes, this patient does look like they could be helped by this. Once approved, we proceed with informed consents. We got to make sure everyone knows. We're never going to tell someone, yes, we guarantee you a cure. What we can do is reprogram your immune response to get going and get fighting. Can cure happen? Yes, we've seen it. We have seen patients go from hospice to remission. We've seen a lot of actually really cool things, but
Wow.
This is not a guarantee. You've got cancer growing and replicating and your immune system is doing nothing. When we get to it, we do get it started. Now the question is, can it overcome it? Can it balance it out? Or is it just not going to get there? We have no way of knowing that. No one can know that. The good news is once your immune system is going, there are other things you can do to bump this up. And some of that includes mainstream medicine, like the addition of checkpoint inhibitors, but then you have other immune boosting opportunities just at home that you can do to further strengthen your immune response. So yeah, I'm going to continue, but do you have a question, Ben?
I want to take a quick break from the video you're watching to share something with you that has made a big difference with my health and the thousands and thousands of students that I teach all across the world. Now, this is a unique device that has been shown to help with skin health, sore muscles, wrinkles, psoriasis, eczema, scoliosis, migraines, sleep issues, arthritis, acne, scar tissue, wound healing, relaxation, and also boost testosterone levels. What am I talking about? What is this miracle drug? Well, it's not a miracle drug. It's red light therapy. As you can see here, this is called photobiomodulation. And I use this red light therapy device every single day. Not only do I use it, my fiance uses it. Our dogs and cats love it. And the device I have here is from Bon Charge. Bon Charge has a different range of big panels, small panels, from affordable to ones that are a little bit more money depending on how much you want. And I love this product. I feel so good. And it doesn't take a lot of time to get all these benefits. I simply take off my glasses, which is Bon Charge glasses, by the way, turn it on, and I have it running for 20 minutes once a day. And turn it on, and as you can see, I just leave it there on my desk as I work. 10, 20 minutes per day will suffice, and it makes a big difference. You're going to notice a big improvement with your skin health and all the things we mentioned earlier in just a matter of weeks. So if you want to get your hands on this Bon Charge red light device or get their big panels, they also have panels that you could take on the go that are more affordable, then head over to boncharge.com/KetoCamp and use the coupon code KetoCamp to get 15% off your red light device, or as a matter of fact, your entire order. Any product, you could get 15% off with that nice coupon code KetoCamp. So whether it's these Bon Charge blue light blocking glasses, their sauna blanket, or any of their awesome products, use that coupon code KetoCamp at checkout. We'll drop a link down below. Go check them out. They are awesome. And let's get back to today's video. I do, yeah. I'm thinking, would Immunocine be... Would it be a good idea to explore doing some work with Immunocine as a preventative approach to get the immune system operating, or is it solely for somebody who has cancer?
Today, it is solely for someone who has cancer. And I'll explain the process. Now, there is an avenue in the future where this becomes prophylactic, but we're not there yet. By we, I mean science, mankind.
Understood.
If I had carte blanche, right, and I could do whatever I want, I could actually probably develop a pathway to get there.
Interesting.
But I don't have carte blanche. So within the confines of current reality, patient is approved. We make sure they fully understand what we're going to do, what to expect. It is only at that time, if they are approved, we say, do you want to come down to Cancun? Do you want to do this? If so, then we are going to move towards payment at that point, which for the record is fully refundable if we do not treat a patient. So if something changes where we now no longer feel it's safe, or the patient simply has changed their mind and says, I don't want to do it. We're not keeping people's money unless we start actual activity in Cancun.
That's great.
Patient will come to Cancun. This will be set up by our coordinators, because we have to schedule. It's a fairly meticulous schedule, but they should be coming to Cancun within about a month of that approval. Cancer changes. Cancer is not going to sit still. And so if you are thinking, I want to do this, but not for 6 months, not for a year, that's fine, but you might as well wait on that review, because we would just have to do it again. You're a different person at that point. So you come down, we'll say it's 3 or 4 weeks later. The first week is the heavy lifting week for the patient, in which they're going to meet with our doctors, do the consultations, blood draws. We make sure everything looks good to go. We're going to do a biopsy in Cancun. This is where we get the target that we are going to reprogram a patient's immune response against, which is why, as of today, you have to have cancer. Because if you do not have a solid cancer that we can grab a biopsy of, we have nothing as the target. We have nothing to create an immune response against.
Yeah.
So come to Cancun, we do the biopsy. This is usually outpatient. In the event it needs overnight care just to ensure safety, we'll make sure the patient stays in one of the hospital suites so we can keep an eye on them. The biopsy goes to the lab. The patient then goes through a process for a few days of getting their white blood cell count up, and then we do what is called apheresis, which is a large blood draw, in which we collect a lot of those white blood cells. That all goes to the lab as well, and week 1 is done. Week 2, there is nothing for the patient to do as of today. Maybe in the future we come up with something to put there, but right now the patient is free to either, hang out on the beach. Beautiful beaches in Cancun. A lot of fun. We're very near the touristy hotel zone area of Cancun, so a lot of really good restaurants, good, entertainment, good hotels. So a lot for people to do if they just want to hang out in Cancun, but they're free to go home, of course. This is where we're doing all of the empowerment in the lab. So our scientists are now at work in the lab. They are taking that tumor sample. They are breaking it down to its blueprints. We're talking its very specific RNA components, a complete protein library. This is a highly, the scientist, everyone's highly trained. This is, not something I could go through easily on a podcast. It's pretty laborious, but all of it's critical. And this is part of what makes our process so unique, are some of these steps. Those blood cells we took are actually being converted all week into the right kind of dendritic cells. This is important. You cannot get enough dendritic cells from a blood draw alone because they circulate through the lymphatic system and tend to sit in tissue. They don't just float around in your blood. So we have to actually almost differentiate them in the lab. And if you're not careful, and if they are not differentiated correctly, you can make the wrong kind of dendritic cell that actually would be counterintuitive and immunosuppressive. So obviously we don't do that, but yeah. I can't speak for every other group out there attempting to use dendritic cells.
Once you create the right dendritic cells, and then how is that administered to the patient?
Right. So those dendritic cells then are reprogrammed or reloaded with the blueprints of the cancer. And the way we do it, I can't, but the way we do it is, this is our patent. This is patented. This is not, it might look simple. No one else does this. One, if they are doing it, it would technically be patent infringement. But 2, this is new science. This is, again, our discovery. You load the dendritic cells this way, and they suddenly wake up. You can almost see it. They change their genetic signature. They become these immune powerhouses. It's just kind of like the light went on and they say, oh, we need to be targeting that. Other groups using dendritic cells do not do this. And so their dendritic cells don't work. And so what they have to do is come up with some artificial way to try and stimulate some activity. And whether that's toxins or bacteria or some component of a virus, whether it's something artificial that might, in fact, stimulate activity. Now, it's not necessarily going to be the right kind, but because of what we are doing, because the way we do it is this is just biology. This is just how the loading occurs in nature when your body actually does recognize a threat. We don't have to do any of that.
Wow.
All we're doing is taking your own dendritic cells, your own cancer, loading it the right way. Okay, you're ready to go. Now you asked about how we give those dendritic cells back to the patient.
Yeah.
This is another unbelievably simple but unique process to us. And again, covered by, I can't believe this is covered by patents. The way dendritic cells have been used in the past and still today, sometimes some groups use them IV. Hey, look, IV is easy. You hang a banana bag and it goes in. It's been well documented that now the dendritic cells will all get stuck in the lungs where they're basically useless. But hey, it was easy to give them back to the patient.
Oh, wow. So IV is not going to work.
No. You've got other groups that do intradermal. Hey, a shot. And yes, it's been well documented that this does work pretty effectively if you have skin cancer only.
Okay.
If you don't, the dendritic cells are focused on the skin. This also is not going to work for a majority of patients. We don't do either of those ways. That's ridiculous. What we do is, again, follow biology. Where should this immune response be happening? It should be happening in tumor proximal functional lymph nodes. So the lymph nodes that are still functional and near the cancer are the ones that should initially be activated to see this immune response. And so our interventional radiologist will go with either ultrasound or CT, but it will be image-guided injections near sweet spots of lymph nodes around the cancer. This is critical, but we're, as best as we can tell, we are the only ones doing that. And so we believe this helps get a stronger, more accurate immune response. I'm going to point out at this time that the injections are actually separated by 2 weeks. So kind of around day 14, if you were following the trend, right? Week 1, we get all the material. Week 2, we build the immunotherapy product for the person. Day 14 is the first injection. 2 weeks later is the second injection, and 2 weeks later is the third. And I'll talk about those 2-week intervals, but people have asked, well, why separate by 2 weeks? Again, we're following biology. Immune kinetics has long demonstrated, to the point that, my 6-year-old can Google this and figure this out. When you see an initial stimulus, like you're seeing with these dendritic cells, your immune system will ramp up for about 10 to 12 days before it starts to wane. You then give a boost right there on day 14. It now escalates that immune response to its maximal plateau, which is great. And this is where a lot of our patients might feel the most symptoms. And the 2 week later after that is going to help instill what we call memory, immune memory, which will help this response go much, much longer, long after you've left Cancun. So again, a patient has, or someone might say to me, I know another group using dendritic cells and they give all 3 of their injections in the first week, 1 week.
Yeah, that doesn't make sense.
Why do they do that?
Yeah, based off of what you shared, that doesn't make sense.
You just wasted injections 2 and 3.
Yeah.
It's quicker, but it doesn't work. And what do you want? If you are putting your life on the line, if you really want to fight, we can go a cheaper, inferior, quicker route. We can make you a disgusting pizza if you want, but we've chosen to just basically, we cut no corners. It takes the time it takes the manufacturing it takes, but what we give you is a legitimately unique, strong immune response that actually does ramp up and start fighting the cancer.
I have a lot of follow-up questions on that. So let's call this one round, right? Where you said that's what 4 weeks total. Is that how many weeks total?
The total?
Yeah,
6 weeks.
6 weeks total. Got it. So they would be in Cancun for those 6 weeks. Some people could fly back and forth.
Yes, I was about to say the 2 week intervals in between. Your immune system is ramping up inside you. Now, that can happen on the beaches in Cancun. It can also happen at home. It can happen if you're back at work. You do not have to stay in Cancun during those intervals.
Okay.
And so now if you do, we will keep an eye on you, of course, make sure everything goes well. But this is all outpatient. And most patients have manageable symptoms, which we can discuss. But you are free absolutely to go home for 2 weeks. And we just tell you when to be back in Cancun. We check on you each time, make sure things look right, and then we give you your injection. So yeah,
6 weeks total. Let's call that one round. How is that's it? One round and you're done? 6 weeks and you're done? Or if it's sometimes really aggressive, they have to do this several times?
No, as of today, it's one round. So that's it.
And then how soon should you start how soon will you start noticing some improvement, if there is going to be improvement?
So, yeah, you put me on the spot there, and I have to be careful with how I answer this, right?
Yeah.
Truly, every patient is different, and we have seen, it's a basket catch of cancers. Some have a little cancer, some have a lot, some have, and then it's prostate, triple negative breast, neuroendocrine. So let me give you some extremes, I guess. We get your immune response going over this 6-week interval of your life. And it keeps going. And people have asked, well, how long might this take? And we have seen patients take as long as maybe 1.5 years, where it just continually gets better, but it takes time. The cancer did not form overnight, and it's not going to be gone overnight.
10, 20 years. Now, how long on average does it take for that tumor to form?
Excellent question. So obviously it depends when it was caught, right? I mean... Right. So that's actually a tough one to answer, because it really does depend on how early did you catch it. But obviously, some people have had these cancers developing for, it could have been more than a decade. If it's really slow moving, you may not notice any symptoms. We have had patients that have seen results in Cancun within the 6 weeks. That is not everyone's experience, but we've had a number of patients who have seen demonstrable evidence of success before they've left, before they've even finished the treatment. So let me explain a little bit. Let me caveat it just a smidge. Sure. It also depends on what basket we want to look at. So what we say right now is that we are seeing more than a 90% response rate.
Wow.
And to give some context, checkpoint inhibitors, which I referred to earlier, are currently the golden medicine in cancer immunotherapy. They are everywhere. They are in a ton of clinical trials. They are non-specific. It's just boosting the immune response, but they're everywhere, and people and doctors love them. If you look at all the FDA trials and all the approvals, the average response rate, objective response rate, is about 20%. Some lower than 10, some in the 30s. That means 4 out of 5 patients are basically not even seeing a response. And that is our gold standard right now.
And you're getting 90%, 9 out of 10.
Correct. So because our approach is far more specific to the patient, right? Again, I don't want to mislead. And whenever someone watches this 5 years from now, the number might be different. But as of today, pretty much everyone we have treated sees reasonable evidence of a response, of an immune response. And so you've mentioned this too. People sometimes view symptoms as bad. People ask, obviously, what are the side effects? And I have to say, they're not really side effects. They're just effects. Your body is sick. The fact that you have cancer and you have no symptoms is not good. You have cancer, you should be sick. And so when we do this reprogramming, all of a sudden your body, you'll see swollen lymph nodes. You'll have muscle aches, tenderness. You might have some light nausea. You might have low-grade fever. Fatigue is a pretty big one. Now, your hair's not going to fall out. It's an immune response. But your symptoms will range from mild, hey, I'm a little under the weather, I've got a cold, to severe, which could be nausea and vomiting. That's actually not the norm, but it's certainly within the realm of an immune response. These are short-lived. I mean, they usually are heaviest or strongest right after the injections. But that is, it's hard to look at it this way when you're feeling so bad, but those are phenomenal signs. Because remember, what did we do? We took out your own immune cells, your own cancer, did this in the lab, put them back in, and all of a sudden you've got this rampant immune response going.
Mm-hmm.
What does that tell us? It tells us it's on. It tells us it's going, because if it's not finding its antigen, if it's not finding a target, nothing's going to happen.
Right.
The fact that this is being found is phenomenal news that your immune system is now actually functioning and working. And so we like to see those symptoms.
Yeah.
And
so you're essentially like turning on the car's check engine light. Now you could actually see things are wrong. Before it was broken and you had no idea, but now you're actually seeing that check engine light, and that's actually a good thing, not a bad thing.
I have never used that analogy, but that's a great analogy. I'm going to use that. Just because your check engine light isn't on because it's broken doesn't mean something's not wrong with the engine. And so, yeah, no, that's a really a good one. And so, we get that going in 6 weeks. And, I would say patients with more cancer, like literally just more tumor burden, do experience harder symptoms, which makes sense.
Of course,
need more of an immune response now. And we've had some patients with relatively small but deadly tumors. And, sometimes they're actually a little disappointed. They don't really feel very much. And they're, is it working? And we can say, well, your tumor markers, which were accelerating before you got here, suddenly plummeted. Cancer doesn't normally just do that. And so this is a positive sign that probably we are targeting the cancer. And
so that's how you're measuring progress. One of the ways you're measuring their tumor markers. What else are you doing?
Yeah, no, that's a good question too. So we look at quite a bit actually, and we are expanding, I'll tell you now, to look at even more. We are scientists, and so we collect as much data as we can. And as an aside, all that data is available to the patients. We do not hide data or keep data, good or bad. It is the patients and their doctors to use after they leave Cancun. At a minimum right now, we do before and after scans. So we will do scans to actually look at the tumors and see if we're seeing any evidence of regression, or in about 65% of patients, we see pseudoprogression. So we'll come back to what that is, because it's really important to know what that is. Okay. We will do before biopsies, of course, and we will look at them. If not too invasive, we will do later biopsies, not necessarily after, but hey, it's been 6 weeks since we started. Let's do another biopsy and see if we can see immune infiltrate. And so sometimes we can literally see, look, there are the immune cells attacking it. We don't do this if it's a laborious or dangerous or not an easy biopsy. We don't want to put the patient through stuff just for more data for us. But that's a possibility. We do routine blood work. Every patient will get at least 4 different blood workups, if not more, over the course. And we will look at almost, you name it, we look at it. We do look at a lot. Of course, we want to make sure our patients are being taken care of, are healthy. Do we see any other indicators where we need to maybe supplement with a medication? I mean, these are cancer patients, and they could have other issues not related to our treatment, but just related to their cancer. And so it's on us to obviously monitor and help take care of them. And so we will look at things like lymphocyte sequestration. Very often, especially in patients with a lot of cancer, we will see lymphocytes leave circulation. So it'll go down. But where did it go? We didn't give them dendritic cells, which make lymphocytes, T cells proliferate, and then they all vanish. They didn't vanish. They're where they're supposed to be. They're all actually in the tumors right now. And so we're actually seeing less circulating in blood randomly. We'll sometimes see uric acid go up, which goes up when you have a lot of tumor tissue death, because they're dying, they're releasing these components. Cancer, obviously, yes, we'll look at inflammatory markers like alkaline phosphatase or LDH or C-reactive protein, sedimentation rate, things that we know are evidences of, is there an inflammatory immune response happening? And of course, we will look at cancer markers for each patient, and it will just be, obviously, that is based on the cancer they have. If you have breast cancer, we're not going to look at PSA. If you have prostate cancer, we would. And so we'll look at those, and so that does bring me to another point to chime in, and you can cut this in or out of the podcast as you wish, Ben. But pseudoprogression has become a big issue in the past 5 years. And a lot of publications are warning doctors, patients aren't going to read these publications, but doctors to be very aware, since immunotherapy has come to the playground, pseudoprogression has become a bigger issue than before. And so what is pseudoprogression? Pseudoprogression is, by all evidences, outwardly, it looks like the cancer is progressing, but it's not. It's actually fake progression that is being caused by the immunotherapy. And so, to give an example, because we do see this actually pretty often with this treatment, your immune cells are now blowing up this cancer. The cancer cells, as they die and are releasing debris, this might actually initially make cancer markers spike up. And so we just saw it go up. And if you don't know this, you might freak out and say, oh my gosh. We had a woman down there right now, and between weeks 1 and 2, injections 1 and 2, one of her cancer markers went up 12-fold. I mean,
wow.
it went from 200 to 3,000. I mean, it was just like an insane jump, like too fast. That's not cancer progression. If that was normal cancer progression, she would not be here today. Like that was a very good sign that the immune response was fighting. Now, in her case, between injections 2 and 3, here it had dropped 90%. It had come crashing down. Now, it doesn't always happen that quickly. That's a great sign of pseudoprogression. In line with that, when we do scans, if tumors, especially if multiple tumors all swell up roughly the same percentage or same amount close to treatment, that's great. Why is it swelling? It's swelling because the immune cells are infiltrating, and actually that brings with it fluid. There's a lot of extra cells and they swell. Now, by scan, you can't tell that. By scan, you look and say the tumor's bigger.
Right.
And so, again, if you're not aware of this, and especially if patients go home and their doctors have no idea, they may say, oh my gosh, your cancer markers are elevated and your tumors are bigger. And look, we can't say it's never progression. It could be. We actually, as a mankind, are trying to figure out how we can distinguish pseudo progression from real progression a little better.
That would be huge. But that makes sense to me, to see those temporarily increase and then go back down and then decrease overall. So okay, I have a couple of I have one more question on your treatment, and then I want to finish with keto.
Yep.
Are there any cancers that Immunocine, your immunotherapy works better for? Any cancers that you cannot help? Any cancers that this works really good with, some that are more difficult, and then some that you cannot even work with at all?
Yes, I can answer that. And I'll answer that in possibly a bit of a random order. But so as of today, we are not treating hematological malignancies, which are blood cancers, whether it be of the lymphatic system or AML or anything. We're not treating blood cancers. We're not treating heart cancers, and we are not treating brain cancers. Now, I say that, and an astute viewer is going to say, I thought you were doing a GBM clinical trial, which is brain. And for the record, the trials are going really well. We're actually being told the FDA may be able to fast track approval for these indications. Absolutely. There's no reason it couldn't work against blood cancer or brain cancer. It's actually more of a matter of safety. Understood. We're not set up in Cancun for the potential of inflammation or swelling in the brain like we are in the States. And so we just wouldn't be prepared for those potential side effects. Whereas if you've got some extra swelling of your tumor in your prostate or your liver, your body can handle that. You're not really going to feel that. That's manageable. In your cranium, it's not as much. So those are cancers. Blood cancers we can't biopsy. That's kind of the main issue. We can't actually get a sample of it. So that brings me to what cancers do we treat? Solid cancers that we can safely grab biopsy from. It is almost that simple. The immune system does not necessarily care if it started in the pancreas, the spleen, the kidney, the lung. They don't care. It surveys your whole body. It can do it. It can get there. It just needs to see it. And so the questions become, can we get a safe biopsy? Sometimes we cannot, just based on its location. It's not considered safe even by the doctors in the U.S. And that does
Like what?
present
Give
a
me an
problem.
example. What would be an example of that?
Yeah, if a tumor is too intertwined with a major artery,
Okay.
where you might risk bleeding out, for example, it might be considered too dangerous at that time to do that. So it's just kind of an example. Lung cancer is a 50-50. It depends on how much lung cancer. Inevitably, as I said earlier, with an immune response is going to be inflammation. How much inflammation can your lungs handle? If you've got a couple small nodules, that's usually fine. But if you've got a lot of lung cancer, this might be too dangerous.
Yeah.
So solid cancers that we can grab a biopsy from, we do typically have to get a fresh biopsy in Cancun because the way biopsies have been stored for pathology and scoring in the States is not amenable to our process. So that's usually not going to work. You asked about better or worse responses. Again, I'm a scientist, but by definition, almost there have to be some cancers that this will work better for, and some that won't.
Right.
We have not identified yet what will be what. We've had a neuroendocrine tumor that had nearly vanished before the woman left Cancun. I mean, was that just her case, or is that something where neuroendocrine tumors might be very approachable by this? I don't know, but that was a very good, very quick response.
Yeah.
We had a triple negative breast cancer patient where her numbers all came back down to baseline, and she became what we would call stable for at least 5 months and is ongoing. Stable meaning cancer wasn't really getting smaller, but it stopped progressing. It stopped getting bigger.
Wow.
I mean, if it stays there, she's fine, but I can't predict the future. So, and she's, this does illustrate an add-on point of, she said 5 months later, well, what if I help things out by adding a checkpoint inhibitor and some low-dose chemo? And we said, go for it.
Yeah.
Our treatment does not rule anything else out. And it becomes part of, it could do it. It could take it all out. But if it doesn't, or if you don't want to just rely on that, absolutely, there are other treatments that might be synergistic and beneficial to add, and take it out while you've got it on the run. There's no reason to not at least explore those opportunities.
Yeah, not just treatments, but also other lifestyle changes you can make too. Combination of both. Yeah.
Well, Ben, that's where I want to bring you in, and we talked about this. I'm going to make you like their life coach and tell them, okay, you can't just lay on the couch. You've got to at least walk around. It's an immune response. Get moving. What are you eating? I mean, we did have a patient down there, and her diet consisted of basically cupcakes and candy. And look, we're offering this treatment, and we're going to do that, but we're not necessarily in a great position or to tell her what to eat. I mean, we can make suggestions, but it's, if you're just going to eat sugar like that, you're really just fueling the cancer.
For sure. Yeah.
So, it is, lifestyle changes can absolutely be a part of it. So anyway, that answers. So we can treat a lot of cancers though. It can be in conjunction with with other treatment approaches. Now we may have to work on, should this be done first or later? How aggressive is the cancer? Yeah. How much time do we have for this immune response to ramp up? All that goes into our medical review and our decision process. But I think we can help a lot of people.
You are already. It's incredible. I'm just blown away by what you're doing. How many, rough estimate to date, how many people have you taken through this treatment?
Sure. So in a story I don't have time to go into today, we did kind of work a 1.0 version of this treatment with some partners in India over the years while we were at Baylor. Long story I won't go into, but I bring it up because this did lead to a published trial, which did look at 51 patients in a basket catch trial with good results. Actually led to a few approvals in India. We then started offering the 2.0 in India, which we treated about 12 patients from the United States, flew to India to get this. We have treated roughly around 15 patients right now in our FDA clinical trials, and we have not yet seen what would be called an SAE, or severe adverse event. So we keep an eye for that. Is there going to be something severe? But typically dendritic cells don't work that way, and so we don't usually see what would be considered severe or significant adverse events. And then in Cancun, we're around 25 patients. We really just launched this a little over a year ago, and we've been admittedly a little bit maybe overly selective with who we're treating. Again, we want to make sure we're ethical and we're doing this correctly. As you know, I'm a scientist with a PhD, and in grad school they don't teach you how to market. That's not really part of my training. So how to get the word out about this and differentiate it from a lot of the other junk has been a little challenging. So a lot of this is just right now word of mouth, someone who knows me and wants to go. But we've started 2023 pretty hot. We've got just 8 patients in already for this year. Our target is 50 for this year. So we're if you add it all up, we're probably around about 100
Awesome.
patients. We can factor in about 10 dogs that we helped, and then of course.
Oh, really? Oh, interesting.
And yeah, dogs get cancer, so we will factor that in. In fact, we have a publication where we did do a small canine trial, and then of course this is all based on about 17 years of research in the lab, which constitutes all manner of mechanistic understanding and whatnot. So
yeah. That's awesome. I love that. And, conversations like this will get the word out. So please share this. If you're listening and watching, share it with somebody you know who has cancer. This is a game changer. We got to wrap it up. We got to talk about keto and the article that you've written. But somebody's going to be thinking, what does this cost? And does insurance cover the cost? Or are there some insurance that covers it? So what's the rough estimate of cost, if you could share? And does any insurance cover this treatment?
Yep. Nope. Thanks for giving me. So right now, insurance, do not count on insurance covering it. It is experimental. It is outside the US. We have had patients actually get reimbursement though. So we think there might be an avenue, because some of the stuff that we have to do, such as a biopsy, is kind of standard. Yep. But you should not count on that. Now, 2021, the National Cancer Institute publishes a paper that points out that late stage and advanced cancers, when all is said and done, the out-of-pocket costs are about $120,000 to $145,000 on average. That's in the United States. That's if you have insurance. It's not all at once, but those bills trickle in. Remember that biopsy, remember that chemo, remember that office appointment, et cetera. It actually adds up. In Cancun, since we cannot do that, we do have to ask for the money up front, because that is the money we use to buy all the fresh reagents for the patients. So there is a little bit of sticker shock. All in, we're usually around, $80,000, so $75,000 to $85,000 to do this. And again, so that's up front. We'll say it's $85,000. We have to have that to buy all your stuff. On the one sense, this is actually a great rate. To understand, it covers everything. That covers everything I mentioned before, from doctor's appointments at the beginning, the biopsy, the blood work, the scans, the pathology reports, all the manufacturing in the lab, paying all of the doctors, all of the scientists, all of the visits, everything throughout covers that. It also covers intra-Cancun transportation. So we pick you up at the airport. We handle all your trips to and from hotels, to the medical appointments. And so that's just what it is. If we have to put you up overnight at a hospital or something like that, we do not. There's no trickle in bills from us. It's just part of the process. So it's already, that aspect's already covered. But yeah, the raw costs of this are unfortunately very high, because it's personalized and fresh. And
understandable. I mean, like you said, out of pocket. You said out of pocket people, for those who have insurance with late stage cancer, they're spending over $120,000. This is less than that, and it's actually doing something that might actually work. Right? We can't guarantee it. Right. It might actually work much better than traditional treatment. And look, it's not an expense, it's an investment. If this is literally life or death, right? So it's like, yeah, it costs that much, but this is literally life or death for so many people. So I get it. And I'm sure as more people go through this treatments and it becomes more popular, the price could go down a little bit over
Absolutely.
the years, right? Yeah.
Oh, absolutely.
That's
I mean, it will never be cheap. And look, big pharma will never love this approach. They would much prefer a drug you can make that sits on a shelf and it's one size fits all. And this sort of thing where you need dedicated scientists and a lab and you've got to process everything per patient is, it's time consuming and it's expensive. And so it's never going to be a favorite of big pharma. But exactly what we do seems to be working. And so that's what we do. And, we're trying to do what we can to make this as available as possible for as many patients as possible.
And your website, it's immunocine.com.
Yes, so
we'll put it down below. We have a couple more minutes here. We wrote an article together, but I would say more accurately, Matt wrote an awesome article and I contributed a bit to it because what you did was phenomenal. So speak a little bit about the article. We'll put a link down below for you all to read it. It's a great article, but it's referencing what a ketogenic diet can do to potentially help with cancer or to be a great partner to cancer treatment.
Yeah, no, I can talk about that. And I appreciate you giving me so much time to talk about the immune system and cancer when I know keto is really your thing. But yeah, we talked in Utah about the benefits or the potential benefits, we'll say, of keto to being healthy and then to cancer, both before and after. And so we decided to write this article, which I'm excited to get out. I probably wrote too much, but it's a lot to write about.
Great.
A lot of benefits to going keto rich in a diet. It's actually a more sustainable, long burning fuel for your body. As I mentioned before, it's not the path of least resistance for your body to use energy, but it is a healthier path. And so I like to go keto rich. Not as much as you. I haven't gotten around to that yet, but I'm definitely on that. But what struck my interest really is the potential that going keto rich can help in a fight against cancer. Obviously, I'm focused on cancer. So can being keto rich help prevent cancer in your diet? It would appear as such. Obviously, we're dealing with patients who are past that point. And so we've got to do a little more. We've got to add some sort of aggressive therapy, this immunotherapy. But there was a publication very recently, and Ben, we might want to add a link to that as well, but it is referenced heavily in the blog we wrote, in which scientists were looking at the effects of what they call a keto-rich diet, but a ketogenic diet, on the body's ability to not only fight cancer, but to synergize with immunotherapy in the fight against cancer. And what they found were, and I'm speaking as a scientist, where a lot of times all you see are just incremental movements, just a small change. They actually saw some pretty profound improvements in the body's response to immunotherapy and to eliminating or fighting back the cancer when they were introduced to and sticking to a keto-rich diet versus not, specifically showing effects for BHB or beta-hydroxybutyrate, which honestly, that one paper made me a believer that we probably should be, I'm saying this now, we should probably be offering this to all of our patients, not just telling them to eat smarter, but as a way to even boost that. Because I mean,
for sure,
they even show that blockade of the BHB receptor almost eliminates the benefit they saw. I mean, they're very directly linking ketogenic benefits, and I know you can talk a lot more about the metabolism of a keto-rich diet and what comes from that. But I mean, it was a very well done publication, and that almost, I was like, we gotta write a blog. We gotta let people. I mean, obviously, people should be healthy and not get cancer. That would still be my number one advice. Don't get cancer. Once you get cancer, it's tough. It just is. But even after cancer, people might want to poo-poo, like, it's who cares now about a lifestyle change, or who cares about what I eat now? it actually still matters, right? And it at this point, it literally could be a life or death difference. What are you
Absolutely.
putting in your body? And so, yeah, I'm really excited to get that blog out and kind of see what bounces off of some of those recent publications, and maybe we can do some studies ourselves and see what we can't discover there.
Absolutely. Yeah. So much potential there. So we're going to put that article, the blog post that we co-wrote together in the notes. So if you're watching on YouTube, that could be found down below. If you're in the listening to the podcast, we're going to put in the notes down below, and you'll see the references that Matt just referenced with the study on a ketogenic diet with immunotherapy. And yeah, you're so right, because according to the CDC, at least right now in the US, 1 in 3 women are diagnosed with cancer within their lifetime. For men, 1 in 2. It's just a matter of time. It's like, so you want to do everything possible to delay that or avoid that. And for sure, if you have cancer, you want to explore these treatments with a ketogenic diet. And we could talk so much more about this. And I think we got to do a round 2, because there's a lot of groundwork, a lot of areas that we could have gotten into, Matt. But your website is immunocine.com. Where else do you want to send them to check out your work, or is that the best place?
So I think that is going to be a good spot to start. Now, we do have a Facebook landing page. We are on LinkedIn. We just started on Instagram. So I am trying to get these social media sites and available for people to find. Heal Navigator is a really good independent third-party site that refers patients to potentials like this, where we have worked with them. They have vetted us and verified us that we are real and not just doing nefarious things in Mexico. So I think that the site and some of those social media platforms are good areas to start to get in touch with us. Yeah, we're hoping to grow our influence and our sphere there, because like I said, I know that there are patients out there that can benefit from this if they just hear about it. There's an analogy there to what we're doing, but if we can just get the word out to this population, I think we could be very helpful.
100%. We're going to put links for that down below. Real quick, last question is on vitamin G gratitude. What are you grateful for, Matt?
I am grateful. I've become increasingly grateful that I actually get to do this. I get to do something legitimately meaningful. Not everyone necessarily has that, and I have the opportunity to actually transform people's lives. Some of the responses. This is very hard. It's very hard to work in the face of cancer. I honestly don't know how oncologists do it, because you are facing a lot of really tough situations, but giving people extra life or better quality of life, or even more than that, and seeing, Chris is one of the testimonials on our site. I met him. His kids were 9 and 11. He had months to live. He's now 5 years in remission. His kids are, his oldest kid is driving. He's still here for that. I mean, he gets to see that. His kids still have their father. And as a father myself, I don't know. It's a lot of work, and I've made plenty of mistakes, but this is a very meaningful thing to do with life. And it's really exciting. It's ever changing. And that's my answer. My answer is actually being able to do this is made me extremely grateful in and of itself.
Wonderful. Yeah, beautiful. You're doing incredible work, Matt. Thank you. I'm so grateful our paths have crossed, and we'll talk a little bit more about how we could bring the ketogenic approach to your patients. But thank you so much. Everybody share this. Go to the website and stay tuned for a round 2 with Matt coming out later this year. So thank you so much, brother. I appreciate you coming on the show.
Awesome. Thank you so much.